Today, a priority review of rucaparib in ovarian cancer, mixed results for pacritinib in myelofibrosis, a confirmed utility of the MammaPrint assay in breast cancer, and a rolling submission for brigatinib in ALK-positive non-small cell lung cancer. Welcome to Enclave News Network. I'm Gina Columbus. The FDA has granted a priority review to a new drug application for rucaparib as a treatment for patients with BRCA-positive advanced ovarian cancer who have received at least 2 prior lines of chemotherapy. The application is based on findings from 2 trials, the ARIEL-2 trial and a phase 1/2 study. In a pooled analysis of both studies, the objective response rate was 54%, the complete response rate was 9%, and the partial response rate was 45% with rucaparib. The median duration of response was 9.2 months. Response rates were found to be similar regardless of whether patients had germline or somatic BRCA mutations or BRCA1 versus BRCA2 mutations. Rucaparib was granted a breakthrough therapy designation in this setting in April 2015. Under the Prescription Drug User Fee Act, the FDA must make a final decision on the application for the PARP inhibitor by February 23, 2017. Clovis, the manufacturer of rucaparib, is also examining the drug as a maintenance therapy in patients with high-grade serous or endometrioid epithelial ovarian, primary peritoneal, or fallopian tube cancer in the phase 3 ARIEL-3 trial. For thrombocytopenic patients with high-risk myelofibrosis, treatment with pacritinib was found to significantly reduce spleen volume, but it did not improve total symptom score when compared with best available therapy. The mixed findings were from the phase 3 PERSIST-2 trial, which randomized 311 patients to receive either pacritinib or best available therapy, which may have included ruxolitinib. While spleen volume was reduced by 35% with the JAK2 inhibitor, the co-primary endpoint of 50% reduction in symptoms was not observed. The negative results followed a clinical hold placed on the trial in February 2016, based on reports of deaths related to intracranial hemorrhage, cardiac failure, and cardiac arrest. All patients were required to discontinue therapy under the hold. However, the results are still described as encouraging due to the unmet need for this population of patients. Additional assessments and a full data analysis are still ongoing for the PERSIST-2 study, and complete findings will likely be submitted for presentation at an upcoming medical meeting. In breast cancer, clinical utility of the 70-gene signature MammaPrint has been confirmed, giving the assay level 1A clinical evidence. 5-year results show that approximately 46% of patients at high risk for recurrence, but low genomic risk, may not require adjuvant chemotherapy. In the phase 3 randomized MIND-ACT study, patients classified as low risk were shown to have prolonged survival, regardless of receiving adjuvant chemotherapy. Initial results of the trial were presented at the 2016 AACR annual meeting. In the 1,550 patients with high clinical risk and low genomic risk, the 5-year survival rate without distant metastasis was 94.7% for those who did not receive chemotherapy. In those who did receive chemotherapy, the survival difference was 1.5 percentage points, with the rate being lower without chemotherapy. These findings may help physicians to more accurately predict risk of distant metastasis in patients with early-stage breast cancer. The MIND-ACT trial opened in 2007 and enrolled patients at 112 centers in 9 European countries who had the risk of tumor recurrence following surgery assessed through use of MammaPrint, performed on frozen tumor tissue, and also via adjuvant online. A new drug application has been submitted to the FDA for brigatinib as a potential treatment for patients with advanced ALK-positive non-small cell lung cancer following resistance or intolerance to crizotinib. The NDA is based on results of the phase 2 ALTA study, which demonstrated a confirmed objective response rate with brigatinib at a 180 milligram dose of 54%, including a complete response rate of 4%. Patients who had measurable active brain metastases had an intracranial ORR of 67%. The median progression-free survival was 12.9 months. In an arm where patients received 90 milligrams of brigatinib, the confirmed ORR was 45%. In those who did not receive prior therapy, the ORR was 52%. The application was completed following a rolling submission of data, which was permitted as part of a breakthrough therapy designation received in October 2014. Ariad has requested a priority review for the ALK inhibitor, under which the FDA would make a decision 4 months earlier than a standard review. the FDA will assign a regulatory timeline within 60 days. The Phase 3 ALTA-1L study has been initiated to compare brigatinib with crizotinib as a frontline therapy for patients with ALK-positive non-small cell lung cancer, which is assessing the 180 milligram regimen of brigatinib. That's all for today. Thank you for watching Enclave News Network. I'm Gina Columbus.